Hey, I'm Zach Quayle from Crossfit and this is Zach. We're here to talk to you guys a little bit about CrossFit. So, Zach, how do you get started with CrossFit?
I used it mostly as a training regimen while I was in college. I played college baseball and kind of switched over into more CrossFit style training. My roommate introduced it to me. He'd been trying to get me to do it for a while, and so jumped in, got hooked, loved it, and knew it's what I wanted to do. When I got out of school, got my degree in exercise science, and I loved the competitive aspect of it because I played sports my whole life, and so having something to fill the competitive void of my life was really important, and so I really got into it, and it's kind of taken off from here.
Zach, so what do you personally know about cystic fibrosis?
To be honest, I didn't really know a whole lot about it, not until at least I met Kassandra, and so I just know that it's a pretty severe lung disease. And so, because of that, we know that her workouts and her training needs to be modified, especially from a metabolic standpoint.
Okay. And when did you meet Kassandra?
I met Kassandra at CrossFit Knoxville, but it wasn't until that I opened up my own facility, CrossFit that I really got a chance to start working with her and her training.
When you met her, could you tell that Kassandra had cystic fibrosis?
No, I don't think I could tell at all. Like I said, I didn't get a chance to coach her or work with her at all while I knew her at CrossFit Knoxville. But as I began coaching her over at CrossFit she came up to me and explained what she had going on, and I kind of came up with some ideas of how we could modify the training on a daily basis, more geared towards her.
So, as a CrossFit coach, like during the workout, how can you tell if Kassandra's lungs were hurting her, or could you tell just in a typical workout how you could see that?
Yeah, you could definitely tell like her body language would be different if she was experiencing just normal fatigue that you would normally experience in a workout versus like this is definitely like her lungs are really bothering her today. So I worked with her on coming up with a little system with her hands where she would flash a couple numbers to me based on a scale of like 1 to 5. 5 is in like there's no way I could keep going, and 1 is in like I'm feeling pretty good today. As just a way in the middle of workouts to really assess how she was feeling and where we were at.
So over the last couple months of doing CrossFit, have you seen improvement in Kassandra's lungs?
Oh yeah, absolutely. She's improved a lot. We've been able to increase loading and increase volume and reduce rest times, and so she's been really improving.
So besides Kassandra, have you trained anyone else with cystic fibrosis?
I have not.
So Zach, would you be willing to program workouts that were specifically geared towards cystic fibrosis patients in the future?
Yeah, absolutely. Any cystic fibrosis patients who are around the Knoxville area can always come out to CrossFit Courageous. If not, you can reach out to me through email, and we can definitely figure out some programs going forward on how you can train even with the disease.
And last question, what would be your advice to anyone with cystic fibrosis who is unsure whether they want to do CrossFit or not?
The main piece of advice I would give is just knowing and understanding what types of workouts are going to be more metabolically taxing than others. And so part of that's just finding a good coach and a coach who's willing to work with you. Part of that's just being able to understand your body a little bit better and just learning things on a different basis. Like I know Kassandra is really skilled in gymnastics and she's really skilled with a barbell, and so we can use her strengths in workouts, and I know that workouts that are a little bit more metabolic demanding, rowing, biking, running, burpees, anything where a large percentage of the total muscle mass is recruited is going to be a lot more metabolically taxing for her, and so we know that we either need to modify however many reps she's doing, potentially the load, and just being smart about your training and being able to push your limits to get better and to improve your lung capacity, but also not overdoing it and potentially doing any damage.
Awesome. Thanks, Zach.
Yeah, no problem.
Oh, that was so good.